Let me ask you about Obamacare, which you say you're going to repeal and replace. When you replace it, are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
With President Trump's ongoing promise to repeal and replace the Affordable Care Act, or Obamacare, some who rely on the health care plan are worried. Included in that group, those with pre-existing conditions.
And while the president has said several times that coverage for pre-existing conditions would remain in whatever new plan he develops, excuse me, a breast cancer survivor I spoke with isn't so sure.
Help. Right. And we include this notebook.
Pat Halpin-Murphy is one of the lucky ones. She's a cancer survivor in remission.
If my breast cancer reoccurred, it would have just completely wiped out our family.
After Pat was initially diagnosed with breast cancer, she had coverage from her employer, but then she changed jobs.
And I didn't know whether that coverage was going to continue, because I could not risk, as a breast cancer survivor, being uncovered for a week.
That's because for Pat and women like her, there's always a chance cancer could come back. Plus, without coverage, she says costs for treatment are astronomical.
I had a mastectomy, I had radiation, I had chemotherapy, and I had complications, including blood clots. The cost was staggering. We just couldn't have paid it.
Luckily, she was covered. Pat estimates that many of the cancer patients currently covered by the Affordable Care Act wouldn't be able to afford private insurance if the ACA were repealed.
The costs are phenomenal. You have to have insurance.
Not to mention, Obamacare also provides free preventative screenings and mammograms.
And we have all kinds of goodies in here.
Since her diagnosis, Pat threw herself into the world of breast cancer.
Oh, this is a lunch basket.
She runs the Pennsylvania Breast Cancer Coalition and says talk about repealing the Affordable Care Act has many of the women she helps worried.
Each year in the state, about 160,000 people are newly diagnosed with cancer. And about 10% of them, of the whole population of the state, it has some provision under the Affordable Care Act.
Cancer is considered a pre-existing condition, something that President Trump has repeatedly said he wants to continue to cover in whatever new health care plan he comes up with.
Yes, because it happens to be one of the strongest assets.
You're going to keep that.
But Pat doesn't trust that promise.
But at other times, we've gotten a different message. Right. So it's unclear what Congress is going to do before it even gets to the president. So it's all at risk.
She also explains pre-existing conditions are difficult to cover.
The way you cover pre-existing conditions is to have a bigger pool so you can spread the risk over a greater number of people. And if it's going in reverse, if you're taking, in this state, 1,000,001 out of the pool, you don't have a way to spread the risk.
But Republican Congressman Lou Barletta feels strongly that won't happen, and coverage for pre-existing conditions is here to stay.
And that's why I don't feel we can just repeal it without the replacement, without seeing it, you know, and seeing it and making sure that those issues are taken care of, and putting the minds of people who have pre-existing conditions at ease, that we're not going to pull the rug out from underneath anybody.
Yeah.
Unlike the average person, Pat says she isn't waiting to see what happens. She's speaking with lawmakers now, making sure that at least if the Affordable Care Act is repealed, something with solid coverage simultaneously replaces it.
You know, generally the average person is so busy working, taking care of the kids, going to school, etc. They don't pre-worry. They wait till it happens. So it's our job to pre-worry.
Republicans are increasingly talking about fixing former President Obama's health care plan rather than actually repealing it.
They're struggling to decide whether a repeal would come before, after, or even at the same time as a replacement plan.